colleagues. Welcome again to Restore, a podcast hosted by a healthcare worker for healthcare workers, where we educate, empower, and enrich the lives of healthcare workers globally. I'm excited to bring back Dr. Bumi Adeyomo. We had her earlier, and now she's back. And we are very, very eager and hungry to hear her educate us. So we are in the month of September and October, which is a big season for retail pharmacists or community pharmacists, because that's when most people start shopping around for a new health insurance, or they are thinking of preventative healthcare or wellness care, where we get our vaccinations to protect us against the flu virus. So my name is Josephine. I'm a mom, a wife, a business owner, and a community pharmacist. With me today is a mom, a wife, a thought leader in pharmacy. Dr. Bumi is an ambulatory care pharmacist. And many of you may wonder, what is the difference between a retail pharmacist and an ambulatory care pharmacist? So she's going to be bringing to us a lot of insights today around what an ambulatory care pharmacist does to help our communities feel better, enjoy a better health, and always continue to improve their whole health. Thank you again, Bumi, for giving us your time. We value your time. We're happy to hear from you today. So the topic today is building healthier communities through healthcare. And as an ambulatory care pharmacist, many of our guests may want to know what is the difference and how do you help improve the health of the community around you.
Thank you, Josephine, for inviting me. It's always a privilege. It's always an honor to be part of the podcast and to actually talk together as healthcare providers as to what we can do to help our community. This obviously is, as you can probably tell, is passionate for both of us. This is something we really like to do. It's what we've been doing for a long time. It's what we do on a daily basis. So we enjoy it.
Yeah.
And so I take it, I'm really privileged that you are able to invite me again to come back and talk about this. So ambulatory care, I have had both worlds of community pharmacy as well as ambulatory care pharmacy. And it's not a lot of difference if you really ask me, because the goal and the main reason why we do this is still the community that we serve. And we do it just a little bit different. I know I can take us back a little bit to when I was in community pharmacy, where we're frontline, and we still are. We're frontline in terms of vaccination and things like that, to help with, like you said earlier, preventative health care. But with community pharmacy, with ambulatory care pharmacy, we have like a lot of other healthcare providers that work in togetherness with us on site. Now that happens in community pharmacy, but you literally have to probably make a phone call to get to a provider or speak with a nurse. Whereas in ambulatory care pharmacy, you literally can just walk down the hall to the provider. You can walk down the hall to speak with the nurses about the specific patient or specific person that you're actually taking care of. Wow. And so that's the difference for the ambulatory care. Another major difference with the ambulatory care is that we have access to the patient's chart. And so we can literally look and see what medications they're on, some drug interactions, some of the encounters that we are concerned about before we even go and speak with the provider. I'll just give like a literal example. If somebody is on a blood thinner, for example, like warfarin, and they need to get their INR done, regularly to make sure that their labs are up to what we want it to be, to prevent bleeding and things like that. I literally can look at the patient and say, okay, when was the last time you went to the lab? And if they can't remember or they're not sure what it was the last time, I can look and say, okay, you know what? Based on your INR or based on your lab work, I think maybe you do need to speak with the clinical pharmacist for Coumadin. Anticoagulation is what we call it, clinical pharmacist. So now I've worked with another healthcare provider together within the same practice to be able to take care of the patient's condition or concerns at that period of time. Now, we are also community in the sense that we have over-the-counter items. So when patients or my clients come to me and have questions about their prescriptions, or I'm taking this medication and I'm thinking about getting something like a prenatal vitamin, or I want to get a Tylenol or ibuprofen. Do you think it's going to be a good idea to take these medications together? I can literally say, okay, you know what? This is not what I recommend because it's not going to be, good for you specifically, and literally be able to go and tell them what might help them even at that period of time. So that's basically the main similarities and differences when it comes to community pharmacy as well as ambulatory care.
Wow, that's very, very educative, because what you have just said is that as an ambulatory care pharmacist, you have a broader view of a patient's profile. Because as a retail pharmacist, we don't have that insight into the patient's chart. So we always have to put a phone call through, or we have to depend on what the patient tells us. So I do see a lot of benefits from the ambulatory side of pharmacy, where you're able to make a very intelligent judgment through the patient's chart. And I also remember, as an ambulatory care pharmacist, I was able to communicate directly through, I think, the in-house communication channel. You have a way to communicate with your doctors through emails or
chat. We can actually do a chat depending on how important or how immediate we need a response. You can actually chat your provider that are down the street. I call it down the street, but literally they're down the hall from you, next door to you. Yeah. And so they're not busy seeing another patient. Obviously, you can sometimes, with the relationship that you have with your providers, you can literally walk down and say, hey, you know what, I'm working with Mrs. Smith right now, and I want to see what we can do to change something about Mrs. Smith's therapy at this point.
Wow. So coming back to preventative and wellness care within this season, where, for retail pharmacists, this is when everybody is coming in with their kids, with their spouse to get the vaccinations. And you did cite a very important example. As pharmacists, retail pharmacists who are administering vaccines, it's important to really review the patient consent form, because this issue of being on a blood thinner could be a problem, where the patient can actually bleed out after you give the vaccine. You're wondering why the patient is bleeding. So what are some healthy tips that you can give pharmacists in retail and community around being very attention to detail focused on that question that asks about them being on blood thinners?
So as a pharmacist that is, like I said, being on both worlds, it's really important to communicate. Communication is key. You cannot under-communicate. It's okay to ask any questions. No question is really stupid, to be honest with you, when it comes to certain questions that we ask our patients. You'll be surprised what you can get. Try to ask open-ended questions, not questions like, what kind of medications do you take? Or basically, can you tell me what medications you're taking? And let them list them out to you. And then probe a little bit more and ask, what about over-the-counter items? What other medications are you taking? What about herbal supplements? Have anybody recommended anything different to you? Because you'll be surprised what they think. Okay, a lot of people come to me and they think herbal supplements is not a medication because it's not necessarily been approved by the FDA or gone through clinical trials or anything like that. But there are a lot of drug interactions, numerous drug interactions between regular medications and herbal supplements. For instance, we're talking about Coumadin, that literally I crack jokes with my colleagues and I say literally Coumadin interacts with water, because it basically interacts with just about anything.
Yeah,
Something as
that's true.
simple as what you eat, vegetables and things like that. So it's good to always ask questions. So what I would tell my colleagues that are listening to me is don't forget to ask questions. Don't forget to probe. Don't feel like you're being too much in their business, because you'll be surprised what you find out. They could help prevent you from having to deal with it later on in the future.
So when it comes to being a pharmacist, there's no mind your business. Let me mind my business.
No, not at all.
Mind your patient's business. Dig in,
That's
dig.
right.
The deeper you go, the more
The
open-ended
more you find out.
questions,
Mhm.
the more you get to help them improve their healthcare. So that's
Absolutely.
very interesting. With regards to green leafy vegetables and warfarin, patients on warfarin, what are some ideas you can give the new pharmacists that are joining us in the workforce to pay attention when the patients are on these blood thinners and they need to take green leafy vegetables? What are some of those healthy and wellness tips that you want to leave with the young pharmacists to be aware of?
So I'm hoping that I'm not telling my age when I answer these questions, because when I did graduate from pharmacy school a long time ago, it was a no, you are not allowed, period, to have any kind of leafy vegetables or any green leafy vegetables. But that has changed since that time. So basically, it still boils down to communication and asking questions. What amount do they take on a weekly basis? What amount do they take on a daily basis? How consistent can they actually bring it to? So it's okay for them. Of course, we're talking about this, everybody is patient specific. We're talking about with patient, whatever your doctor talks to you, you still have to see based on your consistency with your labs and how things are running specifically for you. But for the most part, it's not an absolute no. It's really, where are you? How many do you take? How can we maintain a balance and consistency that wouldn't affect your drug interactions with Coumadin? And we'll still be able to get what we want in terms of spaces when it comes to your blood levels with INR.
Wow, thank you so much. You have fed us again. We're now very, very ready for this flu season. Pharmacists in the room, healthcare workers in the room, public health workers in the room. We now know that before we go out there to start this busy immunization season, let's pay attention to our patients' consent forms, especially the question that asks about blood thinners or any NSAIDs, anything that could make them bleed out. If you have more questions and you're looking to gain more from our guest speaker, Dr. Bumi, on the area of immunization and community health, or you want to ask some questions to me as a community pharmacist, feel free to connect with us on LinkedIn. Both of us are on LinkedIn, and we love and enjoy hanging out in this room, because when we sit with our colleagues, it's a constructive feeling we feel, because it says iron sharpeneth iron. It says in a multitude of wisdom, there's joy. And when we talk about being joyful healthcare workers, we want to be very aware of the people we hang around. I've enjoyed hanging out with you today.
Same here, as always.
Look forward to another time.
Absolutely.
Thank you so much. Thank you, everyone. We appreciate your time. We do not waste your time. If you want to be a host on this podcast, Restore, where we educate, empower, and enrich healthcare workers to enjoy work-life balance holistically, we want to win with you. So please connect with us. Send me a message on LinkedIn. If you have something to say to your colleagues, I'll be very glad to host you. So let's continue to grow together, win together as we become the best of ourselves. Please do not serve this season from empty. Remember, it's all about self-love, self-care, self-acceptance. You are more than enough. So be encouraged, be motivated. So Dr. Bumi, would you like to say an encouraging word to our colleagues as we round up today?
I think you basically just said it all. The main thing is what you don't have, you can't give. So you definitely want to make sure that you have self-care, you take care of yourself. That way you can give the best of yourself to your colleagues. So you can give the best of yourself to your patients.
Thank you so much. Thank you so much. Thank you, everyone. See you next time. Bye.
Bye.